You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Let's talk about black women who are really being impacted by COVID-19, and folks are being turned away from seeking medical advice. And so black women really are being stuck between a rock and a hard place. Joining us right now is Jocelyn Fry, Senior Fellow for the Center for American Progress. Jocelyn, how you doing?
I'm doing well. How are you?
Doing great. So let's talk about that in terms of, so what are you seeing specifically that's what's happening with black women and COVID-19?
Well, what we're seeing is that, black women, as many of us already know, they're really on the front lines in a couple of ways. First of all, they are disproportionately the workers. They're, home health aides, they're nursing assistants, they're the cashiers in your grocery stores. So they're on the front lines in a quiet way, but yet they're, much more likely to be exposed to infection. They may not have the equipment that they need, and they may not have things like access to emergency childcare, right? Like they still have to be working even though their kids are home from school. So on the one hand, we see them on the front lines, but we also see them on the front lines at home, right? Like black women, much more than any other group of mothers, are far more likely to be the economic support for their family, either sole breadwinner or primary breadwinner. So they're at home, and they're also experiencing job loss. They're in the industries that are losing a lot of jobs, like accommodations and food service. So all of this impacts women, and we're not spending enough time really talking about those issues.
All right, got questions from our panel. Dr. Carter, you got a question?
Yeah, I just wanted to know how you think about this sort of, because I read your report and it was quite comprehensive, but one of the things I noticed is that black women are also a lot of the population of healthcare workers. So you see black women as these working on the front lines as cashiers and other things, but also working in healthcare fields. And if there was any more to say about sort of those women who find themselves in healthcare professions as nursing assistants and other things.
Yeah, I think that's a great point because, black women they're nursing assistants, they're home health aides, they are, one of the top careers for black women is nursing assistant and registered nurses. So they're on the front lines in that way. And we've heard a lot of discussion about things like protective gear, and clearly they need those things just like any other health professional. But they also need access to other services. As I said, if their kids are at home, they need to know that their kids are safe. If they don't want to go home because they're concerned about bringing home the virus, and they may need access to things like housing costs because they're incurring additional expenses. We should be talking not only about how much they're earning, but they should be getting additional pay, premium pay, because they're putting themselves in hazardous situations. So I think it's important to recognize that a lot of times, black women have a history of being caregivers. Right? Like we're used to black women being the caregivers, but not really thinking about what are their own personal work family needs. We just want them to be there, and we just think that they should be there because that's what they've always done, and that's deeply rooted in our history. But it's important for us to think about black women as not only the healthcare workers, but people who also have families. The last thing I'd say is that we also have to think about the fact that they don't earn the same as their counterparts. Black women consistently earn less than other women. They earn less than men. And that's deeply problematic in an environment when they are disproportionately more likely to be providing economic support for their families.
Thank you.
Misha.
have we looked at the role that the healthcare system itself plays? Because study after study has shown that there is a high level of insensitivity when it comes to African Americans, specifically African American women, when we go to visit doctors. We're not getting the same level of treatment. When we complain and talk about some of the symptoms that we're having of certain things, we're either sent away or told, the wait and see approach. And if you're of another race or another gender, then you may be able to see, and you're often able to see and get treated for these things quicker. So we know pre-existing conditions are a major factor in whether or not COVID-19 actually really keeps you down and hospitalizes you. But for African Americans who aren't being treated well for their diabetes, for their blood pressure, for certain heart conditions, these are things that would happen whether COVID-19 was around or not. Is there a message that you have for the healthcare providers themselves?
I think you're absolutely spot on. That's exactly right. This disease is a terrible disease, but it does not happen in a vacuum. And we have to acknowledge that the status quo is already problematic. The reality is that communities of color, and particularly African American communities, have enormous number of disparities, health disparities, whether it's heart disease, whether it's diabetes, that makes them much more susceptible to the disease, and that now statistically being borne out. And you're absolutely right. There's a whole emerging body research around Black maternal health. Because Black women have such high morbidity rates who are when they're pregnant women, and it's consistently clear that part of the problem here is that Black women encounter bias, they encounter racism and sexism in the healthcare system. They're assumed that they can absorb more pain, that their symptoms are not real, that they're told just to go away and come back. And it seems not to be connected to whether or not they have a lot of money or not, right? So this is an existing problem in our healthcare system. And now on top of it, we have this disease that we don't know how to fix and we don't really know how to treat. And so I think what is clear, and this is a message not only for our healthcare system, but really the policymakers who are making the decisions, is that any interventions have to understand that. They have to understand that the playing field that we're operating on is not a fair one. It is one that is structurally biased along race and gender. And so our interventions have to address that in addition to making sure that people get the services that they need.
Rob, your question.
Yeah, so to add to that point, because you and Amisha have both rightly pointed out that COVID-19 has exacerbated current vulnerabilities within our society and current inequalities. What would you recommend as just some practical steps that we can make within the healthcare system policy-wise? You talk about policymakers, so we can make sure that we're holding, policymakers that say that they have our interests in mind to actually doing these things.
Yeah, that's a great question. I think there are a number of things that they could do. First of all, every state, every community in this country ought to be tracking the disease by race and gender. We have some data that shows those disparities, but it's not consistent across the country. It's not always disaggregated. So we actually just don't know enough about who's being impacted, but we know something about the fact that communities of color, particularly African-American communities, are much more likely to contract the disease and to die from the disease. So one practical thing is that we ought to have that data. We should have had it yesterday. We clearly ought to have it tomorrow. We should make sure that in terms of the services that we're providing, in terms of any access to testing, that we're making sure that the communities most affected, many communities of color, many of the hot spots are around communities of color, they should have those tests. They should be prioritized. We should be in those communities working with healthcare professionals. We should be tapping healthcare professionals from communities of color, including healthcare professionals of color who are sensitive to the needs of the communities that they're used to serving. We ought to be, even though training takes time, we ought to be training and working with all those healthcare professionals. Nobody should walk in the door and then be turned away from not getting a test if a test is what they need. And we should be, focusing extensively on making sure that the communities that are most at risk are actually getting the services that they need. I'd start there. to be sure. There are many other things that we can do in terms of supports for families, like access to emergency child care and things like that when people are at home. Those things are important too.
All right, Jocelyn Frye, Senior Fellow, Center for American Progress. We appreciate it. Thanks a lot.
Well, thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, Infectious Disease Specialist, Dr. Georges Benjamin, Executive Director of the American Public Health Association, Malcolm Nance, Family Medicine Physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, Executive Director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Breeze Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and Wellness Specialist Dr. Yolandra Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with The Root. Lamina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, Economist President, Emerita Bennett College. Coroner Michael Fowler is a mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and Executive Director of the Illinois Medical District. Dr. Leon Madugal, President-elect of the National Medical Association. Jana Bailey, Mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.